This is a scenario we see frequently in clinic where people's busy lifestyles result in neglecting their own basic musculoskeletal health, and they end up presenting to us with acute onset problems, whether it's back pain or neck pain or some overuse kind of a scenario. And from a clinical point of view, it's often not an easy conversation to have, because it really depends on where on the scale of the spectrum somebody is. Because lifestyle changes don't usually have an immediate effect, they usually have a cumulative effect. So somebody who's used to being active, who then for various reasons maybe have kids or just busy pressures of family life and working hours and travel, may neglect to do any physical activity themselves. And that obviously won't have an immediate effect unless they're very habitual exercises like me, in which case I tend to get crabby and cranky within the day if I don't exercise, but that's probably a little bit extreme. But generally weight gain will take months to occur. Lack of flexibility, reductions in muscle strength, all those things occur slowly and often under the radar. And really, to judge whether they're relevant or not, we know from a lot of statistical studies that weight gain and reduction in muscle strength are big predisposing factors to injury, particularly as we get older. So as we all know, in the exuberance of youth, in our teens and 20s and 30s, our systems were much more durable, tolerated falls, twists, lifts, bends, carries, these kind of things with relative impunity. And if there was damage done, by and large, it recovered relatively quickly. Those characteristics obviously change as we get older. So we would see people quite frequently in clinic who have postural low back pain, and they would tell you that they spend, the vast majority of the day sitting. There's no incentive to get up and move around. All the work is brought to them on the PC, and they may have a good ergonomic chair, but the simple reality is that prolonged sitting is detrimental to your spinal health. And there's a huge amount of publicity around standing desks and moving desks and changing position, simply because of the implications on spinal health. So you have this conflict here, that sitting seems such a simple passive kind of thing, but in terms of the physical health of the spinal tissues, it's certainly detrimental if it's sustained over a period of time. And again, that's usually a slow onset. It's not usually a sudden scenario. So that's one sort of scenario. So we'd see people maybe who present with an insidious onset episode of back pain or neck pain, no obvious cause, but when we examine them, we find well-established entrenched patterns of postural change, of muscle tightness, of joint stiffness, and these things usually have occurred over a matter of months, and particularly if lifestyle dictates that there aren't counteractive measures being put in place, then these tend to be cumulative. And obviously, if somebody is in acute pain, their biggest priority is just to get rid of the symptoms. And as clinicians, we may say, yes, we can treat the symptoms, which we obviously have to do as a first priority, but then really our focus, both ethically and morally, is to see, can we try and prevent or minimize the risk of recurrences? And so it is incumbent upon us, if we identify established changes and work patterns and lifestyle factors, to discuss these and at least make sure that patients are aware that these are factors that are variable and that they have some control over, which can influence the recurrence of symptoms. Now, if it's the first episode of symptoms that they've had, then you may not necessarily take these predisposing factors too easily. Whereas if it becomes more frequent, more persistent, more difficult to resolve, more intense, then really it's a fairly clear pattern being established that the system isn't tolerating the kind of pressure that's been placed upon it. So from a therapist's point of view, sometimes that's an easier message to deliver, because the evidence is there before you. Now, in terms of actually encouraging people to make changes in lifestyle, obviously everybody has a busy lifestyle. It's not a simple thing of just changing lifestyle. But I suppose if we look at the extreme example of coronary care, generally speaking, people who have an acute cardiac episode, if they've had predisposing lifestyle factors, usually get a pretty clear message that something needs to change, or something fairly catastrophic may happen. With musculoskeletal health, it's not the same sense of urgency. Yes, you may get pain, it may make you miserable, but it generally won't kill you. Now, for anyone who's ever had acute sciatica, and particularly persistent sciatica, you'll know that that's a pretty unpleasant thing, and not something that you would live with. It wouldn't kill you, but it'd be damned uncomfortable. So, you know, what we're looking at seeing is, well, can we prevent people just progressively deteriorating in the function of their musculoskeletal health, and try to put steps in place. And as I say, it's really only as the pain levels become more persistent and start to interfere with quality of life that usually people will then start to say, okay, look, I need to do something a bit different here, as opposed to just sort of crisis management and trying to patch up. And you know, in order to be able to deliver that message, you may say, look, let's see how long we go without a flare up. We've patched up the acute symptoms. It's taken 5 or 6 treatments or whatever it has. You still have the underlying predisposing factors. And from a patient's perspective, you may think, well, oh, is that just somebody trying to squeeze more appointments and more income out of me? Or is it a genuine need to try and address an issue? And it's very hard for a clinician in the first episode to say, yeah, well, that's not going to come back again. It's not an exact science like that. But at least if it's identified early and said, look, it's hard to judge how relevant it is, but if you start to get recurrences of symptoms, then it's really quite important to see, can you modify your neck posture or your seating arrangements or your general lifestyle to try and increase more activity. And that isn't just walking and getting up and moving around. It's looking at flexibility, range of movement, muscle strength, functional strength, all of these kind of things which the body was designed to do. So that does mean having to take a bit of time out. But as therapists, sometimes we can get a bit frustrated that people don't see it, but it really comes down to this balance of how disruptive the symptoms are, whether they can be controlled with palliative treatments, or whether they become so disruptive that they're interfering with quality of life. And then essentially this decision to change lifestyle and to recognize that their system isn't indestructible and it's reached a sort of a crisis point. The analogy that's often used in musculoskeletal health, which is the area that physiotherapists deal with, it's a bit like dentistry was 20, 30 years ago, where 20 or 30 years ago, dentists were largely tooth extractors. So people went to dentists with tooth pain, and if the tooth was bad, it was pulled. Where nowadays, dental health and well-being is really all about tooth preservation and optimizing your dental hygiene. And extraction is really seen as a failure. And I suppose if we look at the same analogy in musculoskeletal health, joint replacement, which is a very prevalent issue, is essentially end stage of failure to manage joint health before it deteriorated to such a level. And I think we will see the evolution of musculoskeletal health over time, where people are much more interested in preserving function rather than resorting to radical steps to replace joints when they become completely dysfunctional. So an interesting topic, another thorny issue for clinicians that we don't often address, but one that is essential. Hope you found it interesting. I'll see you again on another video. Bye for now.